Welcome back to AM Northwest. The health of your mouth can be impacted by problems elsewhere in your body. Here to share how stomach issues can cause dental problems. We're happy to welcome back Dr. Lampee from Sleep Dentistry Defined. Nice to see you again. This is an interesting subject because I don't think people make a connection. So what kind of other health issues, stomach related, can affect your dental health?
Well, a lot of my patients haven't been to the dentist in 5, 10, or 20 years, and they don't really know what's going on in their mouths. And for a lot of people, they want to keep it that way. But I'm here to enlighten them. What we have is stomach issues like gastric bypass, acid indigestion, Crohn's disease, irritable bowel syndromes can cause extra stomach acid to come into the mouth and constantly bathe the enamel of the teeth and slowly soften it and wear it away.
How does gastric bypass do that?
Gastric bypass is, it's a great procedure for a lot of people, but there are so many other complications with it that are short-term but also long-term. And what happens is patients, when the procedure is done, they vomit a lot more after the procedure because they can't keep the food down. They've got a lot more stomach acid coming up into their mouth. And a lot of my patients, they've never had a cavity before in their lives. They have this procedure, and after, say, 1, 2, 3, 5 years, they've got 10 or 20 cavities. It softens the enamel, all this acid coming into the mouth.
It eats away at that enamel. So, and did someone tell me that your first inclination when you vomit, you want to brush your teeth?
You want to brush them vigorously.
Yeah, and that's not a good idea, or
it's a really bad idea because the moment that acid hits the teeth, it really softens that enamel up. And if you go in there and vigorously brush those teeth, you're wearing more enamel away. What you want to do is kind of rinse the mouth out, maybe have a stick of gum, maybe 2, and basically brush the teeth about 30 minutes later. And you're probably going to need a very special toothpaste to basically refortify the enamel, prescription style of toothpaste that you just can't get at the store.
You say immune disorders can also cause problems.
Yes, things like Crohn's disease that often develop for men and women in their late teens, 20s, and even sometimes early 30s. They cause a lot of acid indigestion, a lot of vomiting as well. And I've seen a lot of cases where these young people come to my office with mouths that are just completely cavitated, and there's not a lot we can do. And
are you sometimes the first person who says, I think you may have an issue here, you may have Crohn's disease? Or?
Oh, yeah, and especially with like men and acid indigestion, they don't want to admit that anything's going on there, and I see that they have severe wear of their teeth, and I'm like, do you have any acid problems? They're like, no, but I really need them to go see their primary care physician to see what's going on because it's just totally wearing it away. But back to Crohn's, we've got these young people, with this stomach issue, and their mouth is just getting trashed. And a lot of them live with the stigma that a lot of people think they have meth mouth, that they're on drugs.
Oh, wow.
It can be that bad?
Oh, yeah. It's just terrible.
So acid reflux, believe me, same thing, regurgitation in the acids. So what can people do if they have acid reflux or, chronic heartburn, I guess would be another part of it. Anything that might be bringing up stomach acids, are there things they can do proactively to prevent problems?
Well, first, treat the condition itself. There's Pepsid and all these other, over-the-counter medications. Have everything in check. And then you need to come see your dentist more regularly. You've got to do more cleanings per year. You need to do fluoride treatments. You need special paste to basically refortify the enamel. And then also by coming in more frequently, if there's an issue, we can get it while it's small. So, but it's prevention. And a lot of times, if it is too bad, the condition's gotten worse, we have to basically rehabilitate the mouth. We've got to cover the enamel with porcelain crowns, porcelain veneers, because the stomach acid cannot eat away the porcelain. That is the great thing. So if we can protect the teeth with crowns or veneers, they're going to be all right.
All right, very good tips, and we'll have them all, too, on our website at K2.com. If you'd like more information, give Dr. Lampee a call, 503-646-2273. We'll again have information on our website at KATU.com.
Thank you very much.
Thank you, guys. Appreciate it.